You're getting cataract surgery. Great news! That means clearer vision, and you can even choose how you want to see. During the surgery, your doctor will place a lens that will restore clarity, but you can also choose the type of lens, the one that best fits your daily life. With a monofocal lens, your distance vision will improve, perfect for driving or outdoor activities, but you'll still need glasses for reading. Monofocal Plus gives you a little more than a monofocal, and EDOF improves the intermediate range. Great if you often use a computer, cook, or rely on GPS, though you'll still need glasses for fine print. And with a full range lens, you can see well up close, distance, and everything in between. Yes, everything. Your choice if you want to forget about glasses. Here's a simple chart to make it clearer. If you have questions, your ophthalmologist can help. Every lifestyle is different. That's why there's a lens for every person. The key is to find the one that suits you best, because seeing well isn't just about clarity, it's about freedom. It's about seeing what matters to you and enjoying every single moment again. See better, live better. Choose how you want to see the world.